Okay, what do we think? Shall we make a start?
Yeah, I think we can get started.
Great, thank you. So welcome everyone to this webinar hosted by the Centre for Longitudinal Studies, which is home to 4+ British cohort studies. We're a UK-RI ESRC funded resource centre, and some of our studies are co-funded across many government departments and some of the devolved nations' governments. So I'd like to thank Andrew Friedman and Mike Daly for inviting us to come and give this talk today, and all of their work around communicating about it and their wider contribution to the studies more generally. They're real supporters of the cohort studies that we're going to talk about today, so thank you for that. And thank you to you for joining. We're really excited to introduce you to these studies. My name is Morag Henderson, and I'm here with Professor Claire Crawford and Megan Rainsbury to introduce you to the value of these cohort studies for research and some of the things that you might want to do to get started using the actual studies for data analyses. Just a few housekeeping things before we start. Richard mentioned that we are going to record the session. That's just so that we can share the recording with you afterwards and that you can pass on to colleagues. What that means is that if you have your camera or mic on, you might interrupt the presentation. So we ask that you turn your cameras off and mics muted during the presentation, but feel free to put them back on for the question and answer session, or raise your hand to use the chat function for that. And we will edit you out so you won't appear in the recording at all. The chat function, if you have questions as we go through, please put those in the chat and we will answer those during the Q&A sessions. There's going to be 2 of those today, unless there's something very urgent, and then somebody can keep an eye on the chat and reply to you. But otherwise, we'll save your questions for the designated time. If you have any technical issues, please email that email address. We will be sending you the slides afterwards for reference. There's quite a lot of detail that we touch on today, and so we're not expecting you to absorb it all in this one session. So we will follow up with those slides and the recording as a resource so you can share those with colleagues who aren't able to attend. So let me just take you through today's schedule. It's a sort of game of 2 halves. We've got the first hour where we're going to give quite a high-level overview to the studies and their value and structure. And then I'm going to hand over to Claire, who's going to take you through some examples of some policy-focused research. And then all of us will be able to answer some questions around that first hour in the Q&A session. In that section, I'm going to ask you to complete a poll just to find out what kinds of things you might be interested in learning more about our studies. So it'd be really great if you took part in that. And then the last half an hour is really for those who are, we're sort of guessing that some of you are real policymakers and others some might have more of an interest in data analysis. So the last 15 minutes, I'm going to talk in a bit more detail about the study contents, how to get started with accessing the data and where to go for more information. So if that sort of detail isn't so much of your interest, then you're free to leave at 2:30. Otherwise, please do stick around for that last 15-minute presentation and then time for more questions. At that point, Professor Richard Silverwood, who's the Chief Statistician at CLS, will come and answer questions as well. So let's get started then. So what are the cohort studies? Well, they're a type of longitudinal study that follows participants over a period of time, often like with our cohorts, it's many years or even a whole lifetime. And participants share common characteristics. So birth cohorts follow individuals born in a particular period. It might be a day, a week, a month, or a year. But other cohort studies might be following people of a particular occupation or have a particular illness or disease. These studies follow people throughout their lives, collecting information at particular ages and are often referred to as prospective studies. Since everyone shares a birth year, those differences across time and in outcomes are not confounded by generational or historical differences, so it allows us to isolate some of those important characteristics. Longitudinal birth cohort studies are extremely valuable in the social, medical and behavioural sciences because of this continuity, so we can better identify key developmental stages, critical periods and changes within their individual over the course of their whole lives. So this is sort of a depiction of the life course approach. One of their main values is that that we're following the same individuals from birth or even in pregnancy onwards. And so we can observe how early exposures, such as prenatal or in childhood, shape later outcomes. So they're ideal for identifying those developmental trajectories. We can look at outcomes in these different points in the life cycle, so post-birth, childhood, adolescence, adulthood, midlife, and beyond, and use that prospective information to study the risks and exposures earlier in life, as well as to control for a large number of factors in the analyses. And because the data are collected in sequence, we can see which factors precede these outcomes more accurately. So these prospective studies mean that there's less risk of recall bias or reverse causation because of that temporal aspect, although it doesn't remove that risk completely. And by measuring exposures before the outcomes occur, these studies can help identify potential causal relationships. So, for example, how prenatal nutrition might be associated with health or cognitive development later on in life. And because these studies, we have information about not just the cohort member, but about their parents, and in some cases their children too, we're able to study the intergenerational transmission of certain advantages or disadvantages, whether they be social, financial, or health-based. Another period of the birth cohorts is that we can focus on the period in which participants grew up in. So this slide shows some of our cohort studies, sort of depicted along a timeline with decades, and alongside some of period effects. So these are the sort of societal changes that affect all age groups in a specific time period. So these events or trends that impact on everyone living at a particular time, albeit differently. So some examples here on the slide are the introduction of the Race Relations Act, political trends, we've got Maggie Thatcher there, the introduction of the contraceptive pill, technological advances such as the World Wide Web, IVF, cloning, AI, and these will all affect everyone simultaneously, but most likely in different ways. One example of this is the COVID-19. That was an unexpected health and economic shock. Each cohort experienced that same sort of period effect, that same event, but its influence varied depending on their age. So those born in the 1950s were around 60 during the pandemic. Those in the 1970s were around 50. Next steps were in their 30s, and the Millennium Cohort Study were in their 20s. So these stages of life meant different things for health, education, employment, and well-being. And in fact, we're able to see quite well how our cohort members fared during that period because we had the sort of prior benchmark, the prior information about their life experience. We could observe them during COVID-19 with a sort of three-stage sweep of data that was completely harmonized across our cohort studies. And so we were able to see the sort of lasting impact of COVID-19 pandemic afterwards. So the nature of longitudinal studies allow us to do that. So I've touched upon the 4 cohorts that we're going to focus on today. Just want to make that a bit more concrete for now. So these are the 4 core national cohort studies that we have at the Centre for Longitudinal Studies. But in my introduction, I said sort of plus. So I'll tell you a little bit about some of our new studies that we work with collaborators on. But these are the main focus of today's presentation. And these data are a public scientific resource used by thousands of researchers worldwide. They enable the replication and extension of findings across different countries and time periods. And they're also really important data for a source of policy evidence. So the oldest of our studies is the NCDS. They were born in 1958 in 1 week in Great Britain with a starting sample of around 17,000 people. It was initially a sort of perinatal study. So it had a focus on health. And the origins of that health sort of dimension have remained today, but it's much more multidisciplinary too. The BCS 70 were born 1 week in 1970, again with a starting sample of around 17,000. And these 2 studies are quite well harmonized across, the contents are quite well harmonized, so it allows a lot of cross-cohort analyses to occur. Next steps is slightly different in structure. So we sort of adopted it from, I guess, what you would call the now Department for Education. This was a school-based sample design that was really aimed at focusing on school transition subjects, transitions from school to the workplace, and later education outcomes. So they were born in 1989-90. They had to be in school in 2004 in year 9 in England. And since then, we've followed them up until the age of 20 through that the original Department for Education. And now CLS have restarted the study and had 2 adult sweeps at age 25 and age 32. So we haven't followed them since birth, but they're still considered a sort of birth cohort study because of being born in that same year. The MCS is our youngest of the 4 main cohort studies. This is a cohort of around 18,000 people born across the whole of the UK in 2000 to 2002. And so you can see that this sort of sequence where there's about a 10 to 20 year gap between them, the sequence of cohorts allow us to compare across cohort. So far, I've really focused on the within cohort, that sort of lifestyle or critical developmental trajectories. But here we can start to think about the differences across cohorts. Differences between the groups of people born around the same time. So they're likely to have shared some long-term exposures or similar life experiences that are unique to that generation. So we might consider comparing habits, attitudes, or exposures, for example, like long-term effects of certain diets or lifestyles that are different for one generation compared to another. So we might say that people born in the 1950s are likely to have been exposed to different long-term health outcomes than those born in the 1980s due to different life experiences, diet, education levels, even when compared at the same age. So let's now I just briefly want to mention some of those other studies that we're involved in. We've got a new cohort study. The data collection is about to start, so late next year. This is going to be a study of around 30,000 children who were born in 2020 to 26, and their families. So we're starting to see the next generation of cohort studies. What preceded that was the early life cohort feasibility study, which is really important data in and of itself, but it was designed in order to check the feasibility of a large scale cohort study like Generation New Era. This might involve some of you here, but we're also involved in the Children of the 2020 study that the DFE commissioned, and also the COVID social mobility and opportunity study. So lots of other data that are sort of within our house, if you like, but the main focus are the 4 studies that I've mentioned. These 4, NCDS, BCS 70, Next Steps, and the Millennium Cohort Study. And this is just a slide depicting the timelines for the 4 cohort studies. This chart shows years on the y-axis and age on the x-axis. And this visualization allows you to note when each sweep of data collection occurred at what ages. So you can consider both the spacing between the sweeps by study, by age, and by life stage. And so reading the data points on the vertical, you can start to compare the timing of the data collections within the same decade, let's say, to enable you to consider cross-cohort comparison. If not comparing exact age like for like, then at least a sort of developmental stage where you can compare experiences and how they differ by cohort that they're born in. And this is just a slide with the actual ages on it, although quite small, I realise, but the oldest cohort has had 12 data collections since 1958, excluding the 3 special COVID sweeps. And the most recent data available is age 62 to 65. BCS have had 11 sweeps since 1970, and the last age, the most recent age, is 51, 52. Next steps, you can see that sort of cluster where they were collected annually, sort of in secondary school and into early college or university transitions, work transitions. And then there was a bit of a gap where we then at CLS picked it up at age 25 and then followed them most recently at age 32. So there's 9 sweeps of data. And then the Millennium Cohort Study, our youngest, have had 8 sweeps so far, and the most recent data age 23 will be released early next year. So I'm just going to say a little bit about the types of information collected across the life stage. I'm going to do quite a high level description here, then I'm going to zoom in a little bit just to show you how the structure of the data works. So this slide shows the types of information collected across the life course, those different life stages along the top. And there's a vast amount of information collected about cohort members. The content is multidisciplinary, spanning social, economic, psychological, and medical or health-based. The columns are meant to depict the sort of life stage specific measures. So we obviously don't ask about friendships or childhood or school at every age. We focus that on childhood and adolescence. So the content has to be age appropriate or life stage appropriate. So this just gives you some examples of the kinds of things that we ask at different stages. And then there's a shift as you move through to adolescence and early adulthood, where it's more about like transitions to adulthood, I guess, so work, partnerships, and parenthood, developing a career, establishing wealth as you age into middle adulthood and beyond. And then the white arrow along sort of the band at the bottom, that shows the types of repeated measures that are included. And so we frequently, almost at every sweep, ask questions about their health, their well-being, employment, education, skills, and family relationships. And if we are asking about employment in childhood, then we're asking about their parents' employment during their childhood. So we have that really important intergenerational part as well. So the scope of information that's captured allows us to better examine those complex interactions between the biological, psychological, health-related factors. So, and we do also collect genetic data. So some examples of the kinds of research that you might see from this are how genetic predispositions might interact with early life environments to influence disease risk. It also enables researchers to control for lots of different factors like class or income, parenting style, number of books in the home, to better isolate things like the association between parental education and their own educational attainment. So an example of that intergenerational educational mobility. So having such diverse and rich data allow us to better isolate those associations so we can make conservative estimates between how one variable might affect another. The findings from the cohort studies can guide interventions and policies, such as early childhood education programmes or public health initiatives, the influence of an introduction and a change in benefits for a particular cohort, for example. And we know that you and your colleagues in government use the cohort data to shape policies on health inequalities, ageing, social mobility, among many others. Before I hand over to Claire, I want to show you this. Hopefully it's not too overwhelming, but I think it's really useful to see the structure of the actual data. So this is an example from the NCDS, the 1958 study, which is the oldest study. So it gives you the full life course and the sense of what's included. And we sort of are a bit unapologetic about the fact it's rich data. That does come with its complexity, but we've got so much information collected. It's such a valuable resource. And so for this study, you can see that some sweeps were in person, most of them were. Some included nurses' visits, others included telephone or online mode data collection. The early sweeps of the study, the main respondents were the parents, particularly the mothers, although the cohort members at those early stages also completed cognitive assessments, answered a few self-completion questions. They wrote an essay at age 11 about what they might imagine their life to be like at age 25, and we recently analysed some of that data. As they turned 16, the cohort members themselves became the main respondents and sort of transitioned, from age 23, they transitioned to being the main respondent. And so from this age, details of every qualification they achieved, together with the dates of every economic activity, partnership, or children that they had, have been recorded. So we've got really comprehensive life course histories. As I said, the study sort of started as a perinatal mortality survey, so the focus was quite a lot on health amongst mothers and newly born babies. So the early focus was very medical, but it became more diverse as time went on. And schools actually reported their exam results as part of the study. So we have a sort of an objective measure of their school exam results. Height and weight were collected at most sweeps. Where it's green, it's self-reported, but the rest of the time a nurse actually collected that data objectively. We also have in the linked data row that's sort of in orange, we make mention of some of the administrative data that we have linked to the study. So it's linked to the hospital episode statistics data for many of the sweeps in adulthood. We've sought consent for economic records, and so we're trying to enact those linkages now. It takes a bit of time, but we're hoping to keep enhancing the study through those administrative data linkages. I've mentioned on the slide here that there's area of residence, so these are sort of census level geodata, but we actually have exact geospatial coordinates for the studies from 2004 onwards for this study. So it allows us to take the coordinates and link that data to other sources such as green spaces, weather, pollution data, number of fast food outlets, etc. So it's opening up a huge amount of possibilities for exploring environmental exposures in relation to many life outcomes. You'll see from this that the number of participants taking part in each sweep shown at the bottom, like all longitudinal studies, suffers from attrition, but we still have over 8,000 who responded at age 62, and there's lots of statistical techniques that allow us to address some of those missing data issues. I should say that although I've spent a bit of time talking through this particular example, the slides that we're going to share afterwards will give you a high-level overview in the same structure for the other 3 cohort studies. So hopefully you'll be able to look at those in your own time and come back to us if you have any questions. So that's my first bit. I'll come back in a moment or two, but I'm going to hand over to Claire, so Professor Claire Crawford, who's going to show you some examples of policy-relevant cohort research using these data. And I know that she wrote this section of her presentation in combination with Megan Rainsbury, who's based at CLS. So I'll hand over to you, Claire. Thanks.
Right, thanks so much, Morag. So yeah, in this section, we're just going to give you a bit more of a flavour of the types of policy relevant questions that the cohort studies can be used to investigate. It's really, as Morag's already touched on, it's really quite a broad range of things that the data can be used for. And actually every year, evidence from the cohort studies is cited in various publications from central government, devolved administrations, local government, parliament, and so on, as well as by kind of reports from third sector organisations, think tanks, charities, and so on. So it really is data that's used widely across a whole spectrum of organisations to address a whole range of questions. So I'm obviously only going to be able to give you a very quick flavour of the kind of breadth and depth of the research that has been done, but I'm going to share a few examples to give you a sense of the types of questions that the cohort data is like really well set up to cover. There are, of course, many more that we could have drawn on as well. So the first thing I'm going to talk about is research which showcases one of the real strengths of the cohort study data, which is the ability to look at what happens early in someone's life and explore the relationships between that and what happens to them later on. So cohort study data is particularly well suited for those types of questions. So I'm going to draw just one example here, but there are many, many more that I could have talked about. And we picked this one just because we know that it's something that's very relevant to the Opportunity Mission. We know that the data has been used as part of the evidence base that has been generated around that programme of work. And so this piece of work is just thinking about how you can use cohort study data to look at the relationship between family income in childhood when a child is growing up, and what is the relationship between that and how much someone goes on to earn themselves later in life once they're an adult. So I'm just picking out there's been a lot of studies which have looked at this question, examined it from different perspectives. I'm just going to pick out one of the pieces of work that's been done on this. So this piece uses data from the British cohort study, so the cohort who were born in 1970, as Morag was just describing. And what this study did was looked at the relationship between family income in childhood. There's a couple of measures of family income which are aggregated to look at income, a proxy for income across the whole of childhood. And then they related that to the earnings of individuals at different ages in adulthood between age 26 and age 42, which was the most recent data at the time the paper was written. And so what they found is that income had a strong relationship with later earnings, as you might expect. So just to give you an example from the most recent period of data, they found that for every £1,000 of additional family income that a child was exposed to during their childhood, they went on to earn around £500 more themselves at age 42. So that's a pretty strong relationship. But actually what they found, which was particularly interesting and has important policy implications, is that that relationship gets stronger over time. So as people get older, the strength of that relationship increases. And it also seems to matter more for people who go on to be higher earners themselves. So I'm just going to show you this figure, which will hopefully give you a sense of those kind of relationships that I was just discussing. So this figure shows you the strength of the relationship between family income in childhood and adult earnings using a particular measure, which is known as the intergenerational income elasticity. You don't need to worry too much about exactly what that is, but essentially you can just think of it as a way of understanding for every pound more that you have in terms of income in childhood, how much more are you going to go on and earn as an adult? So higher numbers indicate a stronger relationship. So this figure is conveying two things, the two kind of summary facts I just mentioned. So the first is how this varies by age. So the different ages are shown using the different coloured lines. So from age 26, the darker blue line at the bottom, up to age 42, the lighter blue line towards the top. So it's showing you how these relationships vary by age. And it's also showing you along the x-axis how much this relationship differs for people who go on to earn more or less. So the relationship at different points in the earnings distribution. So for people who earn relatively little, their relationships are shown on the left-hand side. For people who earn relatively more, those relationships are shown on the right-hand side. So you can read it as going from poorer or lower earning to higher earning as you go from left to right. So first, if we look at the different ages, you can see that generally the smallest relationship was identified at age 26. That's generally because people who've taken different educational qualifications have entered the labour market only relatively recently in some cases. And because we know that earnings grow a lot in the early part of people's careers, that those differences haven't quite worked themselves out. The people who've entered the labour market a bit later, their wages are still growing relatively quickly. And so you can see the relationship is generally less strong at age 26 than it is at the other ages. But beyond this, if we look at the other coloured lines, we can see that those relationships do get stronger as you get older. Not dramatically so if you look at those who are earning relatively little, but much more so if you're earning a lot. So if you look at that kind of fanning of the figure on the right-hand side, that's showing that for people who go on to earn quite a lot, the importance of their family income is really strengthening as they get older in the labour market. And that's suggesting that it's really coming from a rich family that is driving those who go on to be relatively rich themselves. So the strength of the relationship is particularly being driven by individuals who are kind of perpetuating their family's success. So that's one example of a study which has really exploited the value of having data right the way from childhood through to middle and older ages. Another strength of the cohort study data is the fact that, as Morag was saying, you can compare what's happened to different cohorts at similar ages, but at different points in time. And this is an example of a study which has done that. So this is a study which has focused on the gender wage gap. So it's focused on comparing how much men and women earn at different points in time and how that varies across different cohorts. So they've looked at earnings at age 25, so relatively early in life, but that's the way that you can maximise the kind of cross-cohort comparisons that you can do. So in this study, they focused on the the NCDS, BCS, and Next Steps data, so the three of the older cohorts that CLS manages, and they've paired that with a cohort who were born in 1946, who are managed, who have a very strong health focus and who are managed by another team in UCL. So they compared these gender wage gaps for individuals born between kind of the mid 1940s and 1990. So what did they find? They found that the earnings of men and women have converged really markedly between those kind of oldest and youngest cohorts. So we've gone from a position where there was a really very sizable gender wage gap to one which is much smaller. But actually, that's really only happened for non-graduates. We haven't seen the same picture emerging for graduates, which I'll show you in a minute on a figure. And then, of course, one of the great things that you can do with cohort study data, because of the very rich picture of information that we have for individuals throughout their lives, as Morag was describing, what we can do is kind of throw a lot of information at these gaps to try and see how much of them we can explain based on the very rich information that we know about these individuals. So how much can we explain of the gender wage gaps based on what happened to people earlier in their lives, the qualifications they obtained, the experiences they have earlier in the labour market, and so on. So that's the kind of second thing that this study did. And unfortunately, in this case, the answer was that it didn't actually get you very far. In many studies, that data really does have a lot of power in helping to understand why descriptive relationships that you might see in the data emerge. So the very rich information in the cohort study data is often used to explore mechanisms through which different relationships arise. But actually, in this case, it wasn't as powerful in explaining these gender wage gaps. So this is the figure which I'll just talk through relatively briefly. And of course, these slides will be shared with you afterwards if you want to look at the figures yourselves in more detail. So this is showing you the difference between men's and women's earnings for graduates on the left and non-graduates on the right. And each bar indicates how much more men earn than women in roughly percentage point terms. So the bigger the bar, the bigger the gap there was between how much men earned and how much women earned in favour of the men. So in each kind of panel, we have the 4 bars representing the 4 cohorts, from the oldest on the left to the youngest on the right. And then the different colour shadings are how much of these overall gaps, which is represented by the total height of the bar, can be explained by the different characteristics that are included in the data and which the authors included in their study. So you can see that kind of early life factors are indicated by pink shading, qualifications by green, experience by orange, and kind of family structures by blue. So as I mentioned, you can see from the figure on the right that amongst men and women who are in work, who are non-graduates, the men were earning significantly more than the women in the earliest birth cohort. But by the time you get to the latest birth cohort, whose data were observed in 2015, you see that those gaps have shrunk to around a quarter of their original size. So there is still a significant gender gap, but it's certainly a lot smaller than it was for that earliest birth cohort at a similar age. But amongst graduates on the right-hand side, you can actually see a slightly different picture. So here the pattern suggests that, number one, the gender wage gaps are much smaller for graduates than non-graduates, but also that, if anything, they might be rising slightly over time. So a slightly bigger gap amongst the graduates in the most recent birth cohort relative to those in the earliest cohorts. And I think the other kind of striking thing that this figure shows is that the coloured shading, especially amongst the non-graduate group, is explaining really very little of these total gaps that we see. So the differences that we're seeing between the earnings of men and women are really not being very strongly driven by these other things that we can observe about them in the data. So that points us towards a range of other issues that could be relevant in thinking about gender wage gaps. Okay, moving on to our third example, and I've got two more examples. I'll be slightly quicker on these two, don't worry about the time. So these are two examples of studies which have taken advantage of those amazing linked data resources that Morag was describing have been added to the already very rich information that is collected directly from the cohort members. So this is showcasing a study which has used some of that linked data. It's a paper that hasn't been published yet. It's forthcoming in about a month or so. So we're sharing these results with you under embargo, if you don't mind. And we will follow up in about a month or so with the paper so that you can see all the results in their full glory if this is something of interest to you. But we're just giving you a sneak peek today. So this paper uses the Millennium Cohort Study, and it uses the linked education administrative data from England that has been brought into the study. So this is, for those who might be familiar with it, data from the National Pupil Database, so administrative data collected from pupils going to schools in England. And it relates information on school absences, which that data contains, as well as attainment, although I'm going to focus on the absences here. It relates that to data that was collected from the survey members or based on information from the survey members at age 7, which focuses on the quality of the housing in which they were living at that point in time. So the authors related what the housing conditions were that you lived in at age 7 with school absences throughout an individual's school career from right the way through from primary to the end of secondary school. And they found strong evidence that of a link between living in poor quality housing, particularly damp and overcrowded housing at age 7, and higher school absences really throughout somebody's school career. Because of what's available in the administrative data, they were able to look at both authorised and unauthorised absences. So that's generally authorised or absences often related to health, illnesses and so on. And unauthorised absences are those for other reasons. So they found evidence that both of those types of absences were affected. And they found that some evidence that the relationships were a bit stronger in primary school, but actually they continued throughout someone's school career. So I'm just going to show you this figure, which illustrates exactly that point. So this is showing you what is the effect on the percentage of missed sessions of school, so absence rates, if you lived in a low quality house or flat at the age of 7 relative to living in a higher quality house or flat at age 7. And you can see that this is showing you how that relationship varies over time as individuals move through the academic years in school, from year 1 in primary school through to year 11 at the end of secondary school. And then in the shaded box on the right-hand side, you can see the kind of overall average across those all year groups. So the lighter shaded dots are showing you the relationships before accounting for any other information. And the darker shaded dots are showing you what happens when you take into account other things that also differ between people who live in different quality houses. And I think one of the nice things that this study is able to do is, because we also have information on family income, we can look at the effect of housing over and above the income level of the family, so the quality of housing to which they might potentially be able to have access. And even once we take that into account, you can see that most of these dots are indicating that the living in a poor quality house at age 7 is reducing the amount of time that individuals are spending in school, or increasing the number of sessions they're missing, the number that for which they're absent. And if you accumulate this across someone's whole school career, it adds up to around 15.5 days of absence. And amongst this cohort, the kind of average level of absence was around 86 days in total across someone's school career. So that suggests that if you were able to improve housing quality, you could potentially reduce school absences by almost a quarter. So it's suggesting that there is a strong role that is played a strong role between housing and school absences. And the final example I'll share with you just showcases one of the other data sources that are linked in. And this is rather than individual level data from administrative sources, as was the case in the last example. This is geographic linked data. So it's allowing us to further characterize the neighborhoods in which individuals are living, not only at one particular point in time, but actually throughout their childhoods, because of the fact that, and adulthoods, because of the fact that, as Morag says, we have this very complete address history in most cases. So I mentioned in one of my earlier examples that the cohort studies are really good at helping us to understand the links between early life outcomes or early life circumstances and later outcomes. But actually, we can even be more specific than that and help us to pinpoint exactly when, during particular life stages, exposures might be more severe and lasting. And one of the things that that has been done is to link in a lot of very rich information about the areas where people live in terms of the environmental exposures that they might have experienced. And this study focuses in particular on air pollution. So the World Health Organization has highlighted poor air quality as one of the biggest environmental threats to human health. So in this study, which again uses Millennium Cohort Study data, researchers linked information on air quality at different points in time in all the addresses that they lived at, in order to understand when they might have been exposed to different levels of air quality and how that related to their later self-reported information on health. So they found that young people who lived in more polluted areas, who had lower air quality during their early years, went on to report their general health to be worse at age 17 than their peers who grew up in neighbourhoods with cleaner air. And this figure just gives you a kind of sense of what the relationship looks like. So these are two different measures of air quality, but both show very similar patterns. So individuals who were exposed to relatively poorer air quality earlier in their lives, around kind of ages 3, 4, 5, were the most likely to go on and report relatively poor health at age 17. And relating to the question that was put in the chat, many studies using the cohort studies also try to understand how relationships vary across different types of individuals or different types of families. And that's one of the things that the researchers in this paper did. They found that young people from ethnic minority families and more disadvantaged homes were much more likely to grow up in neighbourhoods with poor air quality. So they are potentially more susceptible to these negative health outcomes. So this is just one example of the type of geographic information that individuals are able to make use of in the cohort study data. But we also have a wide range of other environmental data, such as population density, traffic noise, and so on and so forth, as well as other types of geographic linked data, such as kind of proximity to, as Morag was saying, green space or particular types of other services. So that's just a flavour of the types of research that can be done using the data. If you're interested in knowing more about whether the data could serve your particular area of interest, there are various ways in which you can kind of get in touch with us or keep up to date with the types of evidence that we're producing. So you can subscribe to our newsletter using this link. You can follow us on LinkedIn and Blue Sky to get kind of very up-to-date information about the latest things we're publishing. But there's also resources that help you understand the stock of CLS research and how it's made use of the data in more general. So we've got a CLS bibliography. You can access it by clicking on the link here. That's essentially a searchable online database of over 6,000 research papers which have been produced using cohort study data. So you can look there for any evidence that might be particularly relevant for topics you're interested in. And if you've got a more specific question and you can't find evidence of how you might be able to understand that or address it in more detail, do feel free to reach out to us directly using this email address, and we should be able to get back to you with any specific evidence that might be relevant. And I think that's all from me. So I will stop sharing and hand back over to Morag.
This is, Claire mentioned about where to go if you're interested in the evidence or policy-focused research. But if you're interested in more resources about our data, please visit our CLS website. There's study pages, so each of the 4 cohorts, and indeed the additional cohorts I mentioned, have their own sort of pages, including data documentation, user guides, questionnaires, technical reports, and data access. And some of that I'm going to talk a little bit more about in part 2. There's also a training page for upcoming events that are open to everyone. This is a sort of special policy-focused one for you. But we've got lots of upcoming events related to the studies more generally. And we also have a YouTube channel that has lots of really valuable recordings on methods, on specialist data. So if you're interested in the linked health data, how it's structured, then you can watch one of those existing recordings or keep an eye out for live events coming up. So we sort of top and tailed it a bit, so that the first part that I gave you was quite a high level overview, although I realised I went into quite a lot of detail for the NCDS data, just so you could see the structure. This is going to take you a little bit more detail about the kind of contents or the features of the data. It's going to be particularly useful, I think, if you're an analyst, but you're very welcome to stay, even if you're just working with the evidence, so that you can start to see the kinds of questions that we could potentially answer using the data. I'm going to give you an overview of the contents by what we call scientific theme. There's too much, I think, to go into detail here because it's such a lot to absorb, but I'm going to show you one particular slide that gives you a sense of the detail of the contents. And then in the slide pack that we'll send you afterwards, there will be all of these scientific themes. So just to reiterate, the following slide refers to the 4 core cohort studies. So the NCDS 58 study, BCS 70, Next Steps, who were born in 1989-90, and the Millennium cohort study, who were born at the turn of the millennium. And the subjects that will be covered in all of the slides afterwards, but I'm going to focus on today, are these kinds of areas. There's so much to sort of show you, but there are many, many more. So I don't want you to think that this is a sort of exhaustive list, but I will show you how to search through the data yourself so that you can see what exists, how it's measured, how it was worded, and at which sweeps it was worded at. So I'll take you through the structure of the slides of the data. So this area we're going to focus on as an example are occupation, earnings, and income. And this is a sort of summary variable descriptions are noted in the column on the left. And then each subsequent column shows the 4 different studies, going from the oldest, the 58, to the youngest, the Millennium cohort study. The numbers in each of the cells relate to the specific age or sweep that the data was collected. So it's age, it's not sweep, it is age, sorry. And you can see that some of them are, those that are in that sort of bluey grey colour are self-report, and then the oranges are the parental report. So you can start to see where we can do some of that intergenerational analysis that we mentioned. And each age tells you essentially when that data was collected. And as I mentioned, these are sort of quite high level categories. So for some of them, the exact question wording might be slightly different across age and sweep and study. And that's partly because every time we collect data, we're trying to think of the most sort of advanced scientific way to ask the question. So there are sometimes improvements over time, which makes things slightly different or change, or it's sometimes related to the age that we're asking the questions of. So the wording at age 16 in NCDS for the parents might be slightly different to the wording at age 50 for the cohort member. So there's a reason for that variation. It's not perfect, but there's usually good reason behind why it's been adjusted over time. So this is just giving you an overview of the types of measures capturing occupation, earnings, and income. Earnings from work are captured quite well across the studies. I can see I've not updated the MCS age 23 data yet, actually, but we will have earnings from work for that new data sweep that will come out in January. The earnings are money obtained from work. Income is money received essentially on a regular basis for work or through investments or other benefits. So we can capture that quite well across the life course and across cohort. Measures of occupation are captured there. So again, it can either be both of the parent or the cohort member themselves, and sometimes that occupation can be transferred into register general social class or NSEC, depending on the kind of the age of the study, I guess. So the older studies tended to use RG. More recently, we focus on NSEC, but that allows for some intergenerational social mobility measures and those trajectories over time. So occupational trajectories across the life course. The other measures included are things on wealth, so actual financial wealth, housing wealth, savings, debt and pensions. Some of this, again, has slightly more detail in some of the more recent sweeps as we focus more on the value of understanding pensions and wealth more generally, and that we capture parental wealth in quite a lot of detail for the Millennium cohort studies. So the types of research questions you can answer with this data, I mentioned life course socioeconomic trajectories, how earning trajectories from early adulthood predict wealth accumulation later in life, the intergenerational transmission aspect, whether that's socioeconomic status, income, like in Claire's example, education, and how that transmits across generation, both parent to cohort member to their own children. In some cases, we capture information about children's occupation. It can be about the effects of early adversity on adult financial outcomes, so how parental reports of economic hardship predict children's longer-term financial outcomes. It can be about how social inequality sort of changes and develops across the life course. The relationship between these measures, so how do earnings, income and wealth interrelate or interact? You can answer questions on the sort of work, education and economic outcomes, so the participation in vocational or higher education, what those returns to education are and how that changes across the life course and trajectories, as well as impact of particular social policies. So how do government benefits in childhood relate to longer term wealth accumulation? And if you were conscious of a very particular policy related to government benefits, then you could explore that in a specific period effect for the cohort studies. So that's an example. When you do get the slides afterwards, you will get a sort of high-level overview of each of these different subject areas. So hopefully that will kind of whet your appetite or give you a sense of what's included in the studies. But I will show you in a moment how to search the data yourself. Other data enhancements, we've mentioned a few of these, certainly talked about the admin data, the geographical data. I've touched on the COVID online surveys as well. So just to mention that we have some genetic data for NCDS, BCS 17 Next Steps and MCS. For MCS, we have the trios, so not just the cohort member, we have their mother, father and the cohort member. And for each of the studies, we have generated some polygenic risk scores, which are a sort of simplified measure of sort of genetic data that many social science researchers can use in their analysis. The actual genetic data is quite complicated and requires quite a big computer to do it all, but the polygenic risk scores are more accessible for social science researchers, and we can isolate this sort of association between the genetic component and social outcomes. The other thing to mention is that we've got some specific harmonized data sets across the cohorts, so that it allows that easier comparison between cohorts rather than within, on socioeconomic status, BMI, mental health, and the childhood environment. So in terms of how to search the data, there's lots of different ways to do it. I'm just going to take you through a few different options. The first is to go to our website and click on the Exploring Our Data section. Under there, you'll see links to data dictionaries. So these are standalone Excel files that look like this, but don't be alarmed. It basically has sweep data set that the data or the variables can be found in, topic, subtopic, the labels. It has the actual question wording, so you can see how it's actually worded, and you can filter through. So by searching subtopic or topic, you can select on, okay, I'm interested in childcare or childbirth. What features, what variables are included within the data, and how often are they measured, and at what specific ages. So using the filtering is a really useful way of doing it. Maybe a bit old school for some of you, but I quite like that. And so the data dictionaries are available on our website. The other thing that we've developed that's maybe for the millennials amongst you is the variable search tool that is a bit less manual, I guess, but it has the same premise where you can study the topic, the category, and then get the actual variable name and string. This is currently being beta tested, so it's in constant development, and it will be beta tested for a while, but we will very soon be releasing a slightly improved version. So the more people will use it, the more hopefully we can get the sort of the search tool working better, but that's already available, and the link is on the slides, so that the actual screen grab is a live link. Our friends at Closer have a search tool that includes our 4 cohort studies, but in addition to that, all of the UK's longitudinal studies, not just those managed by CLS. So if you want to search for it, you can search for any variable. Here I've searched for life satisfaction, and you can select to look at within specific studies, or you just get a whole long list of all of the different studies that capture that specific variable. So if you're interested in pensions, let's say, then you could search for that across all of the UK longitudinal studies. Some of these are quite old school, but again, I quite like them. The questionnaires are available for download both on the CLS website and the UK data service. So you can actually search through the wording in the questionnaires, but the data dictionaries do something very similar now. You can actually just download the data and search the variables in your preferred software, or reading the descriptions based in published papers, most of which can be found in the CLS bibliography that Claire mentioned earlier. And again, that can be found here on the website. So there's a link to that page that's got the bibliography, the documentation, and the briefings and impact as well. So if you do want to access the data, it's basically, it's a free resource that anybody can access as long as it's for non-commercial use. So I'm very briefly going to take you through that process and then give you places to go for more information. So all of our data is at the UK Data Service, which is a data archive where many of the secondary data sources are available freely to download. There's different levels of security with the data. So I'm sure you would understand we don't just give you the geocodes out available for downloads. You would have to go through some specialist training to access the secure data, to get some more of the sensitive data, anything that's disclosive or considered sensitive. You would have to go through that secure access license, the third one on that slide. Most of the data, however, is available for download, so you can have it on your desktop because it's under safeguarded data, so it's considered low level of disclosivity and sensitivity. And then there's a sort of intermediate version, which is special safeguarded. The safeguarded data, you can log on today and have it on your desktop within minutes. The secure access license data, you would need to register for a training, a centrally run training course, and just be approved, have your project approved before you can access it. So it does take a bit longer, but we're trying to get quicker on that process. But we have to balance that, the risk of disclosure and protecting our cohort members. So that's why there's different levels of security. But to access the data that's available for download, you would go to the UKDS and register, follow their instructions. Each of the data sets have a study page at the UKDS. So this is the Millennium Cohort Study 1. It lists every single data set that's under that study number. And you basically would click on access data. It's actually better to log in before you search, I find. So it's much easier to add the data that you want to your account if you're logged in. And once you're there, you basically click add to your account, sign up, request access, and then you have to sign the end user license agreement, any other conditions of use. And then tie it to a particular project. So you will have to give a very brief overview of the project that you're planning on doing with the data, a title and a short abstract. It's checked in a light touch way just to make sure it's sort of sensible, but it's approved quite quickly. And then once you've signed all of the agreements, you'll get given the option to download the data in whichever format you like, and then you could start analysing or tweaking or playing with the data yourself. Additional resources. So again, this is sort of a kind of getting started, so it's quite an introductory webinar that we're doing today, and we just want to try and do our best to give you a sort of a bunch of next steps so you can go forward and progress with using the data or the evidence yourself. So other resources that might be helpful, user guides I've mentioned, questionnaires, data documentation, quite a lot of detail in the technical reports about the survey methods and the actual fieldwork response and how the data is managed. And so all of those are available on this CLS website. There are also what we call cohort profiles that are peer-reviewed, published papers that give an overarching summary of the data sources and the research using the data. So it documents the years, the kind of contents, the sampling frame and the response rates across all of the studies. So those are available and quite a useful starting point if you want to try and understand the data a bit better. Other resources, again, I've mentioned the study pages on the CLS website. Each study has its own 1 hour long training recording. So in those, we go into much more detail about how to merge the data, how the data is structured, how to actually use the weights and getting started with the data. So I think if you're interested in using a particular study, that might be your next port of call to have a look maybe at speed 1.5 on the YouTube channel. You can access those both through our CLS website and the YouTube channel that I'll mention again in a moment. Some examples of the user guides, the technical report, questionnaires, the documentation, you can sort of see that for yourself if you're interested. Do keep an eye on the CLS training and support page. There's an events page that keeps up to date with upcoming live training events and sessions that are open to everyone and free. And this is a sort of standing resource of all of the different recordings we've taken from live webinars over the years. And they include things like those introductions too. So each of the cohort studies has an introduction of around an hour long. And then other specialist things like the genetics data has its own webinar, linked admin data. So there's one for health, hospital episode statistics. There's some for education, linked data, I think planned soon, as well as by scientific theme. So there's a whole webinar on mental health, on care, social care, on what else? Families. I think families and relationships have their own sort of scientific themes. So you can access those resources and find out more from us. So I'm coming to an end. So we've covered today a sort of overarching introduction to the longitudinal birth cohort studies. We've gone through some examples of policy research using the studies. I've given a bit of an overview of the content of the CLS cohorts by subject area. And we're going to follow up, as I said, with additional slides and resources for those. And also giving you a bit of an overview on how to access the data and where to go for more information. So coming towards an end, so happy to go over to you all for questions or any comments, anything that you want to tell us.